Good morning. Magandang umaga po sa inyong lahat. Allow me to introduce our guest for today's webinar. Our resource speaker for today is a graduate of Doctor of Dental Medicine at the Centro Escolar University Manila College of Dentistry in 2006. He took his residence training program in pediatric dentistry at the Pediatric Dentistry Center Philippines in 2007. Took his internship training program in oral surgery and hospital dentistry at the University of the Philippines, Philippine General Hospital in 2009. Had his certificate in advanced education in pediatric dentistry at the Pediatric Dentistry Center Philippines in 2015. He is a candidate diplomate of the Philippine Board of Pediatric Dentistry from 2017 to present. He is currently taking up his Master in Business Administration in Health program at the Ateneo de Manila University Graduate School of Business. For his affiliations, he is a Fellow of the Philippine Pediatric Dental Society, member of the International Association of Pediatric Dentistry, member of the International Association of Dental Traumatology, also a member of the Pediatric Dentistry Association of Asia, member of the Philippine Dental Association, as well as the Quezon City Dental Chapter. He is presently the consultant and clinical supervising staff at the Pediatric Dentistry Center Philippines, Dr. Fedel Mundo Medical Center Foundation in Quezon City. Consultant and medical staff at Philippine Heart Center also in Quezon City. Department Head Dentistry Division at Ortigas Hospital and Healthcare Center in Cainta, Rizal. Also presently the managing partner with practice limited to pediatric dentistry and oral surgery at Global Smiles Dental Center in BGC Taguig. And lastly, he is a professional lecturer in the fields of pediatric dentistry, dental traumatology, and oral surgery of the Philippine Dental Association Speakers Bureau, PDA Dolphinal, PRMD, 3MS per Philippines, and Pediatrica Unilab. Dear dentists, ladies and gentlemen, please welcome Dr. Jasper L. Tago.
Thank you, everyone. Thank you, Doctora, for that introduction. I'd like to thank the whole group of Dental Access for inviting me to this webinar. And like I said, my topic this morning is going to be very relevant right now. Just time myself. Okay. So, can you guys hear me clearly? Okay naman po. Malinaw naman. And even my slides.
Yes po, Doc.
Yes, Doc. Yes, malinaw.
Okay. Sige. Thank you. All right. So, my topic this morning is about pharmacological management of odontogenic pain and infection in children. So I made this parang mnemonic, no? Ouch, oral urgencies in children. So the learning objective for this morning is number one, to discuss the common medications in pediatric dentistry being prescribed, and its indications and limitations. Number two, we will briefly discuss also the classifications of odontogenic pain and infection in relation to what we're going to prescribe to our patients. And we will review, okay, so the proper way of prescribing common medication used in pediatric patients and in addressing pain and infection. Okay. So the most common reason why children visit the dental clinic is basically two reasons lang yan. Number one, they could be in pain, so much pain, or there's an infection going on. So particularly odontogenic infection for dentists. Now, when we describe pain, this is it's a very broad topic. It is categorized into two categories. the International Association of Study in Pain defined the pain as unpleasant sensory and emotional experience associated with actual or um, actual or potential tissue damage or described in terms of such damage. So it is categorized as nociceptive or neuropathic. So when you say nociceptive, this is the most common type of pain that you will encounter, and it involves nociceptive type of pain receptors or the nociceptors that are specifically designed to detect stimuli that may cause harm to the body. It can be mechanical or thermal in nature. For example, natusok tayo ng any sharp object. Okay, so that's a nociceptive kind of pain. Now, in dentistry or odontogenic, dental pain ang tinutukoy ng nociceptive. The second type is the neuropathic. The neuropathic or the nociceptive or this is the kind of pain that's caused by the damage to the neurons that are involved in the pain signaling pathways in the nervous system. So basically, a neuropathic pain is a reflection that there is an injury or an impairment in the nervous system. Now, where does the odontogenic dentistry kind of pain falls into this category? Pareho, actually, nociceptive. It can be nociceptive or neuropathic, especially if the patient underwent a certain surgical procedure, tapos we've severed the nerve, mga ganyan. So merong neuropathic pain na involved in. So there's also what we call acute or chronic pain, and we know this. Acute is a current, and chronic pain is a lasting type of pain. When we talk about odontogenic pain, there is reversible pulpitis. It's provoked pain and may last for a few seconds. So the pulp is not really infected, but due to an object or any food impaction, this can be provoked. So the diagnosis there is a reversible pulpitis, and you have your irreversible pulpitis. It is described as spontaneous pain. Pagdating sa bata, you ask the children or you ask the parents, Mommy, meron bang night pains? So this will give you a clue that it is an irreversible pulpitis. And it may last more than a minute. So kahit walang kinain or walang napasukan ng pagkain sa ngipin, masakit pa rin. So that's described as irreversible pulpitis already. So the pharmacological pain management is one of the first part of my lecture, actually. So the most common prescription that we give when there is a toothache or odontogenic pain is the analgesic. And these analgesic relieve pain, okay? So they are non-selective NSAIDs, okay? So the most common here is your aspirin, mefenamic acid, ibuprofen, naproxen, celecoxib. But since my topic is about the children, we will be focusing on the following NSAIDs, which is mefenamic acid and ibuprofen. And they are known to be analgesic, anti-inflammatory, and antipyretic. We will also discuss paracetamol, also known as acetaminophen. This is an analgesic and antipyretic as well. So generally, analgesics are absorbed in your gastrointestinal tract. Okay, so it's being metabolized in the liver. So compounds, hepatic disease will most likely lead to significant alteration in their pharmacokinetic behavior. So how does the pain occur? Ano ba dumarating yung odontogenic pain specifically? Paano na-experience yun? So I made a very simple diagram here. Okay, so there's a thing where we call cyclooxygenase. So it can be cyclooxygenase 1 or cyclooxygenase 2. Now, when this COX, or what they call COX enzyme catalyzes, it is a key step in metabolizing an arachidonic acid to produce your prostaglandin and your thromboxane. So basically, yung cyclooxygenase, when combined with arachidonic, nagpo-produce sila ng prostaglandin and thromboxane. Now, ano naman yung prostaglandin? This is an enzyme that is responsible for the pain, inflammation, blood clotting, and protects the stomach lining. So, now thromboxane is responsible for clotting formation. I want you to remember this diagram because later on, it will help us to properly prescribe yung ating patient kapag in pain siya, kung ano ba yung tamang medication na kailangan na i-prescribe natin. So, you can take a screenshot of this picture. The action of, generally, the analgesic, what analgesic does to our body is it inhibits the cyclooxygenase COX-1 or COX-2. Pinipigilan niya yung production ng COX-1 or COX-2. Therefore, wala kang production ng prostaglandin and ng thromboxane. So wala kang pain, wala kang inflammation, wala kang blood clotting, okay, or lessen ng blood clotting, okay, and then wala ring thromboxane that is responsible for clotting formation. So number one very common drug that we prescribe is the paracetamol. Okay, so this is an analgesic for mild to moderate type of pain. This is the first line analgesic of choice for children up to 14 years old. And it may have a little anti-inflammatory effect, pero generally wala siya because this is central prostaglandin inhibition. Okay, this is very effective. Alam natin na very effective ang paracetamol for antipyretic because this is centrally allocated or central prostaglandin inhibition. So, pag sinabing central, it's in the brain. And we know that fever, if there is an imbalance in the hypothalamic area in the brain, nagkakaroon din ng fever. Very effective ang paracetamol because central prostaglandin inhibition siya. Kaya siya very effective for addressing fever. Now, there's a weak evidence of a chronic adverse effects for paracetamol. There, you will see some studies, pero wala masyadong RCT studies when it comes to a chronic adverse effect. The half-life of paracetamol is 2 to 3 hours. And usually you can the patient can buy this over the counter, 80 pesos. The price there is for 60 ml. So take note of the pediatric dose. You have 10 to 15 milligrams per kilogram per dose, okay? And it's being taken every 4 to 6 hours. So you have available, you have available tablets. You have the suspension of 120 milligrams. You had 150, 160, 250 per 5 ml for every 60 ml. Now, how do we compute for the paracetamol? For example, your patient is 20 kilograms, so we compute it by the patient's weight, not by the patient's age. So the patient's age is 7 years old. The chief complaint is pain on the anterior teeth kasi nadapa yung bata, so after trauma. So how do you prescribe? The pediatric dose is 10 to 15 milligrams per kilogram per dose. So we choose the preparation of 250 milligrams per 5 ml suspension or syrup. So you get the patient's weight, that's 20 kilograms. You multiply it to 15 milligrams. The answer is 300 milligrams per dose. So you use this to multiply it into 4 doses because that's 4 doses every day, or it can be 6 also. You know, so that's 1,200 milligrams per day. So the 300 milligrams, you divide it to the preparation of 250 milligrams and multiply it by 5. Your answer is 6 ml per dose every 4 hours. Now, how do we write it when we prescribe it? Take note of the answer that 6 ml. Ano? Medyo mahirap yon for the mother to achieve the 6 ml. Okay, but since we use the maximum allowable dose, which is the 15 milligrams per kilogram per dose, we can go lower down. Ano? We can make it 5 ml to be easier for the parents to give or to measure. So how do we prescribe? So you write the date, the name of the patient, and then you write the generic name, the paracetamol 250 milligrams per 5 ml, and then the brand name, and dispense 1 bottle of 60 ml. Now, in pediatric, no, the signatura or the instruction is always give 5 ml every 6 hours for pain as needed. In adults, we write take, but in pediatric, we write give. And then you affix your signature at the bottom. So that's for the paracetamol. We go now to ibuprofen. Ibuprofen is basically a derivative of propionic acid, and because also it is a central and peripheral inhibition. Basically, pag sinabing central sa brain, and then peripheral sa buong katawan. Ano? So it is a central and peripheral prostaglandin inhibition. So going back to sa sinabi natin kanina, pag walang prostaglandin, okay, wala ring pain, walang may bleeding, okay. So it is very good as an anti-inflammatory medication. It is also analgesic. It has an antipyretic property, but lesser than paracetamol. Okay. Now, the adverse reaction commonly associated with ibuprofen is your gastrointestinal tract discomfort. Some patients will also experience nausea, vomiting, and thrombocytopenia. Okay, ito yung pagkawala ng platelets kasi nga nawawala rin yung thromboxane, di ba? Pinaalis ng NSAID or ng ibuprofen yung cyclooxygenase. So wala rin meron ding thrombocytopenia. Now, ibuprofen is contraindicated, therefore, for patients taking blood thinners. So, why it is contraindicated? Because it acts like a double trouble, no? Because this ibuprofen potentiates bleeding tendencies. Okay, so those patients also who have sensitivity to ibuprofen, they are contraindicated in taking ibuprofen. Now, for sideline, topic about pregnant women, they usually don't prescribe NSAID in general, for during the first trimester and then the third trimester. A lot of studies will tell you when you prescribe NSAID generally, on pregnant women in their first term, it causes embryo, fetal, and neonatal adverse effects. No, so there's a high risk of miscarriages or merong mga defects, okay? Now, when you prescribe NSAID or ibuprofen towards the third trimester, since meron itong it potentiates bleeding, okay? So there could be a premature, high risk of premature labor. That's why it's not being prescribed during the third and in the first trimester of gestation. So also for patients with history of GI bleeding, we cannot prescribe ibuprofen. So the half-life is 1 to 2 hours, and the cost in the Philippine market is 62 pesos per 60 ml. The pediatric dose of ibuprofen is 5 to 10 milligrams per kilogram per dose. Now, it is being given every 6 hours. So you have a preparation of 100, 200 milligrams per 5 ml. So that's in every 60 ml bottle. In tablets, we have 200 milligrams. There's also 400 milligrams, both for gel and tablet. So how do we compute for ibuprofen? Again, we get the patient's weight. This time, the given patient's weight is in pounds, 31 pounds. So how do you compute it? You just divide it into 2.2. So the chief complaint here is sumasakit yung ngipin niya kagabi pa. So dun sa type of pain na diniscuss natin in the earlier slide, kung merong night pains, this could probably be an irreversible pulpitis. So there is an inflammation going on. Okay, kasi note of the history, the chief complaint, kagabi pa. Okay. So pediatric dose of ibuprofen is 5 to 10 milligrams per kilogram per dose. So we choose the preparation of 200 milligrams per 5 ml syrup. So the given here is in pounds. So we just divide it into 2.2. So you will get 14 kilograms. 14 kilograms, we get the maximum dose. I always get the maximum dose. No? So that's 10 milligrams per kilogram. You multiply it to 10 milligrams per kilogram. The answer is 140 milligrams per dose. So 140 multiplied by 4 doses is equal to 560 milligrams. So that's going to be per day, maximum per day. Now, this is very important kasi sometimes we write in the prescription as needed, pagdating sa NSAID. So, maximum of 560 milligrams per day. So, 140 milligrams divided by the preparation that we chose, the 200 milligrams per 5 ml, multiplied by 5 is 3.5 ml. So, again, it may be difficult for the parent to measure the 0.5 ml. Since we use the maximum pediatric allowable dose of 10, we can make it 3 ml na lang, pagdating sa prescription. So we want our prescription to be clear and concise. So how do we write it? You write the date, the name of the patient, so the generic name, and then the brand name. So you dispense you state the number of bottles to be dispensed. So 1 bottle of 60 ml. Again, you write give 3 ml every 6 hours for pain as needed, and then affix your signature. So that's for the ibuprofen. We go now to the second most prescribed medication for dental pain management, the mefenamic acid. So it is a derivative of phenamic acid, and it's also both central and peripheral prostaglandin inhibition, and that's why it is very effective as analgesic. It's also effective as an anti-inflammatory, but lesser than the ibuprofen. It's also antipyretic, but lesser than paracetamol. So basically, they have the same adverse effect as your ibuprofen. So you have the gastrointestinal tract disorders that may lead to GI perforation, as simple as abdominal pain or ulceration, or GI perforation up to bleeding. Okay, that's why mefenamic acid is contraindicated to patients who are less than 14 years old. So I want to be very emphatic about this. You cannot give mefenamic acid to patients who are less than 14 years old. You'd rather give paracetamol or ibuprofen. Okay. Patients taking blood thinners also, these are contraindicated, okay, because it will potentiate bleeding, lalo na yung mga nagtitake ng mga anticoagulants, you know. With patients with history of sensitivity to mefenamic acid, they are also contraindicated. Again, for pregnant women, they are prohibited to be taking these types of medicine during their first and third trimester. Now, Dr. Jasper, what about lactation? You know, yung mga nagpapasuso na mother. A lot of studies will tell you na it's not a problem that you prescribe mefenamic acid. There are weak evidences that will tell you na bawal mefenamic or NSAIDs during lactation. Okay, but again, it would be best that you coordinate with the physician about this matter. Now, history of bleeding also is contraindicated for patients who has GI bleeding history. So half-life is 1.8 to 2 hours. So basically, half-life will just tell you kung gaano kabilis umabot yung gamot doon sa serum level or sa bloodstream ng patient. So the cost of this one is 16 pesos per 60 ml. Now, you will see pediatric dose, okay, for mefenamic acid. Now, Dr. Jasper, bawal ang mefenamic acid pero merong available na pediatric dose. But it is clearly indicated in this preparation that it's for children who cannot take tablets or capsule na kahit 14 years old sila. I usually give this for patients who are special needs patients, yung patients with special needs. May mga ASD na 14 years old and above na, doon po pwede sila. They're considered as pediatric pa rin kasi. So pediatric is up to 19 okay? So the pediatric dose here is 5 to 10 milligrams. This is specifically, again, for children over 14 years old. So they'll be taking this 6 to 8 hours. So the available preparation is 50 milligrams per 5 ml. And so you notice 50 milligrams lang. So sobrang dami niyan when you compute it kasi 50 milligrams per 5 ml lang ang available natin dito sa Pilipinas. So for tablet, 250 milligrams and 500 milligrams. Anyway, kung tablet naman, it can be pounded naman pag tablet ang gagamitin. So how do we compute? So the patient's weight is 37 kilograms. The patient's age is 15 years old. So severe toothache. So pediatric dose is 5 to 10 milligrams per kilogram per dose. The preparation that we choose is 50 milligrams per 5 ml suspension. Let's assume that this patient is with severe autism who cannot tolerate ingesting tablets. That's why we use the suspension for. So 37 milligrams this time I'll multiply it by 5. So 185 milligrams per dose. So 185 milligrams multiplied by 4 doses, 740 milligrams per day. So 185, you divide it to 50 milligrams and multiply it to 5 ml. So 18.5 ml. So ganun nga kadami, pag suspension ang ginagamit. So this is every 6 hours. So how do we write it in prescription? So let's assume December 30, 2019, is the date. Methylamic acid, 50 milligrams per 5 ml, constant suspension. You dispense, you indicate the number of bottles, and then give for patients for pediatric patients. So give 20 ml every 6 hours for pain as needed. So you notice here 20 ml because we use the lower bracket, the 5 milligrams per kilogram. Okay. So that's for mefenamic acid. Now, when we talk about odontogenic infection, definitely sometimes it's coupled with pain and infection. Okay, so these are the most common infections that you see in the child's oral cavity. So these are your vestibular abscess. So odontogenic infection might be localized, like what you see on your left screen, on the left side of your screen, or it presents in the extraoral or surrounding tissue. So this one on your left is a localized abscess, periodontal abscess, and it can travel to fascial spaces. And that's the picture on your right. Now the sequelae of the resulting infection will depend on the following, and this is just a review for us. So it depends on the regional anatomy, the virulence of the bacteria or the harmfulness, kung gaano ba katindi yung bacteria, ka-harmful yung bacteria involved, and the host resistance factor. Okay. And when we talk about regional anatomy, very quickly, it will depend kung yung angulation nung inyong ng ngipin. If the tooth is towards buccal, the axis towards the buccal, usually vestibular abscess lumalabas. Okay? And it's towards the buccal. Pag sa palate naman, thinner yung bone, doon din siya lalabas. Kung saan yung mas makapal na bone or mas manipis na bone rather, doon siya lalabas. Okay? That's according to the Peterson. So location of the root apex in relation to the apex of the tooth, if your muscle attachment is below the apex, okay, like the image letter A, okay, vestibular abscess siya. If the muscle attachment is below or higher than the apex of the tooth, this time it could be a fascial space. So the most common infection that you see in the upper maxillary half of the face, involving the upper teeth. Now, you can tell the parents that it can reach the brain, and also this is one of our cases in the center wherein there is a brain abscess secondary to dental infection. Okay, and we all know that the skull or the skeletal system of the child is not as developed. That's why progression of the infection is quite fast. Mabilis. It can travel anywhere. So for mandibular, the most common is seen on the lower half of the face. So when we talk about the virulence of bacteria or the harmfulness of bacteria, I want to discuss this briefly because we will be prescribing antibiotic. So the virulence of the bacteria, generally, the bacteria that's causing the odontogenic infection, they are polymicrobial. Ibig sabihin, it's a mixture of the same organism, and 90% of which are aerobic. 90% of aerobic are streptococci, and 5% are the staph. The bacteria involved in odontogenic infection, they also have anaerobic, and these are your gram-positive cocci and gram-negative rod. Now, there is a thing such as oxidation reduction. Ibig sabihin, the deeper the infection goes, wala na yung oxygen doon. Therefore, mostly or predominantly you see anaerobic bacteria ang involved pag meron ng yung parang nana. Okay? So, kasi nawawala yung oxidation. And when we talk about prescribing antibiotic, we cannot veer away from antibiotic resistance. Now, this article will tell us that antibiotics, since 2000 pa lang, antibiotic resistance in microbes recovered from the acute dental abscess has been reported to be increasing in some populations studied over the last few decades. Okay, so we have to be very circumspect or careful, in prescribing, even for dental infection, because we may never know that we're contributing antibiotic resistance or antimicrobial resistance on the patient. And that is very evident doon sa pagkakaroon ng beta-lactamase or the beta-lactamase producing bacteria. Ito yung recently, di ba, meron na tayong coamoxiclav, because of this antibiotic resistance. Okay. So the third one is the host resistance factor. This is one consideration also when we manage odontogenic infection. So the question that you want to ask yourself is, does my patient have the ability to fight infection? Okay, so when we talk about this host resistance factor, this is what we ask ourselves. Okay, because the patient's general health will actually determine the severity of the infection. So if you have a pediatric patient who have all these, who have blood disorders, or HIV or AIDS positive, patients who are undergoing chemotherapy, okay, patients with congenitally immune deficiencies, they are considered high risk. Okay, therefore, we have to give antibiotics. So antimicrobials that is being prescribed here are your antibiotics. Okay, second most commonly prescribed used drugs in dentistry. So you have antifungal, antiviral. Okay, but today, for today's topic, we will only focus on antimicrobial. Antibiotics. Okay. So the antibiotics, there are a large number of antimicrobial agents used in pediatric dentistry, but today we will be concentrating on the classifications of your antibiotics. So, ano ba yung microbe na tina-target ng antibiotic na binibigay natin, which we discussed in the previous slide? Ano ba yung mode of action? Kung bactericidal or bacteriostatic ba ito. So when we talk about microbial target of your antibiotic, particularly your antibiotic are considered to be, it can be a narrow or a wide spectrum. Narrow spectrum antibiotic primarily are effective against gram-negative or gram-positive, and it deals with the specific bacteria also. So yung broad spectrum drugs naman are effective against wider range of organisms. So dental and periodontal infections are basically composed of your normal oral flora. Therefore, when we give antibiotics on the patients, meron ding namamatay na normal bacteria. Okay, so many of these organisms are sensitive, to penicillin. Okay, so that's actually the first drug that we will discuss when we talk about antibiotics. So the mode of action of antibiotic is it inhibits the synthesis of bacterial cell wall. Actually, I'll just enumerate all this, protein synthesis, inhibition of acid metabolism, cell membrane permeability, inhibition of nucleic acid, and so on. Okay, so all of these mechanisms of action of your antibiotic produces toxic effects on the bacteria, which selectively interfere with the life cycle of the bacteria or the pathogen while minimizing significant alterations in the human body or in the human cell. So when do you prescribe antibiotic in children? You prescribe antibiotic on children only if there is a rapidly progressive swelling. Excuse me. That's why history is very important. You ask the parents, Mommy, kailan na pa ito namaga? Pag sinabi ni Mommy, ay Doc, kagabi, the child is in severe pain, sobrang sakit. Tapos kaninang umaga, sobrang lumaki na yung mukha. So that's a very rapid progressive swelling. So you may want to prescribe. And when we talk about swelling, wag po ninyong mapagkakamali yung swelling na sinabi ng nanay, kasi you have to ask if it's an extraoral swelling or an intraoral swelling. Kung buko lang po dun sa ilalim or sa loob rather, we may not have to prescribe antibiotic. Ano? So kung ganitong rapidly progressive swelling, like the picture on your right, if the swelling is diffuse, if the patient's immune system is compromised, you think that there's a fascial space involvement, extraoral ang paglaki. There is a severe pericoronitis na kung saan the patient wouldn't open his or her mouth. There is osteomyelitis. Yes, you can prescribe antibiotic here. Okay? But for patients with minor vestibular abscess, katulad ng pinakita natin kanina, yung parang dinidescribe ng magulang na pimple doon sa ngipin, yung parang abscess, vestibular abscess, dry socket, mild pericoronitis, a chronic, well-localized abscess, you do not prescribe antibiotic. So, if there's one slide that I want you to remember at take home talaga, that it would be this slide, okay? I couldn't be more repetitious than about this one because a lot of our dentists are still prescribing antibiotic kahit vestibular abscess lang or yung pimple lang. You do not prescribe it because it is localized already. Ano? The only time that you will do prescribing antibiotic are these conditions on your left. No? So, pag vestibular abscess, no need of prescribing antibiotic. All you have to do is to remove the tooth involved. Okay? So, itong mga ganito, ayan, mas malinaw na. Okay? No need to prescribe antibiotic. Okay? So, how long should antibiotic therapy be? Now, we were taught in undergrad that we have to finish 7 days, no, for the antibiotic therapy. But recent studies will tell you na prolonged course of antibiotics destroy the communal flora or the normal oral flora. Ano? Therefore, the ideal antibiotic duration, this is according to Dental Clinical in North America in 2003, the ideal antibiotic duration is the shortest time that will prevent both clinical and microbiological relapse. Such an approach is appropriate where rebound infections are common, such as fungal, respiratory, or urinary tract infection, which is unwarranted in dental disease. Ibig sabihin lang nito, the 7-day antibiotic therapy are indicated for fungal infection, kung saan yung matagal talaga ang minsan nawawala ang fungal infection. But for odontogenic infection, okay, hindi kinakailangan na 7 days talaga. But let me be very clear about this. Kailangan matanggal yung ngipin o yung root cause ng infection. Usually, nag-e-effect naman po ang antibiotic after 3 days or 4 days. So make sure, pag nag-prescribe kayo ng antibiotic, let's say, prescribe antibiotic for 4 days, ano, on the 5th day, kailangan tanggalin nyo na. Okay? There has to be a surgical intervention involved. Okay? So the duration of antibiotic therapy in most patients with acute dentoalveolar infection can safely be 2 to 3 days, provided that the drainage has been established. So maliwanag po ito sa mga RCT studies, no? na on the 2 to 3 days lang, ano? Kasi that's the time that you will expect that the inflammation will subside and then the patient will be able to go to your clinic to have the tooth extracted. Okay. So what are the common antibiotic agents that we use in pediatric dentistry? So we have penicillin, clindamycin, macrolides, and cephalosporin. So we'll start with penicillin. So kasama sa penicillin are your amoxicillin. Ano, they are primarily active against gram-positive aerobic and anaerobic bacteria. And their coverage varies also. Unfortunately, penicillins have them considered the most allergenic group. Ano? Penicillin V is an improvement of your PenG. PenG is primary oral antibiotic used to manage dental infections. Ito pa rin actually ang first drug of choice natin. However, amoxicillin has a broad spectrum of coverage as ampicillin. But since it is absorbed better orally and causes less diarrhea, kaya mas nagiging popular na yung amoxicillin. So nabanggit natin itong coamoxiclav kanina. This is an antibacterial combination consisting of semisynthetic antibiotic, your amoxicillin, and your beta-lactamase inhibitor, or your clavulanic acid, or clavulanic potassium. So that component, the clavulanic component, protects the amoxicillin from degradation by beta-lactamase enzymes and effectively extends the antibacterial spectrum to include many bacterial normally resistant to amoxicillin. So sagot ito doon sa resistant na to amoxicillin. That's why there is coamoxiclav already. So how do we compute for amoxicillin? Okay, so they come in suspension or chewable tablet or capsule. The allowable dosage of amoxicillin in children for more than 3 months is 40 kilograms. Okay, generally the pediatric dose is 20 to 40 milligrams per kilograms per day. Okay, divided in 8 hours. So divided by 4 ito. 3. So availability in oral form, you have 125 milligrams and 250 milligrams. So how do you compute when you prescribe amoxicillin on children? You get the patient's weight, 19 kilograms. Patient's age is 6 male. So the chief complaint is namaga ang mukha niya paggising, according to the mother. So the pediatric dose is 20 to 40 milligrams per kilogram per day. So the available dose is 20/50 or 125. I choose the 250 para mas kakaunti yung iinumin ng bata. So here we use the weight of the patient, 19, and multiply by 40 milligrams per kilogram. The answer is 760 milligrams per dose. So you divide the 760 into 3. So you have sorry, this is the 760 milligrams per day yan. So you divide it into 3. You have 253 milligrams per dose. Okay, so the 253 milligrams, you divide it into 250, and multiply it by 5. So you have 5 ml per dose every 8 hours. How do you write it in prescription? Amoxicillin, 200 milligrams per 5 ml. You can write a brand name under it and dispense 1 bottle of 60 ml. So you give 5 ml every 4 hours for 4 days. Okay, because here I'm appointing or I'm scheduling the patient on the 5th day for extraction na, or on the 3rd day. Come back on 3rd day for extraction. So the article kanina that I quoted, dapat merong surgical intervention na kasama when we do or when we prescribe amoxicillin. Okay. Now, how do we compute for co-amoxiclav? It comes in suspension and chewable tablet. So we compute it based on the amoxicillin component. Okay. So the pediatric dose for co-amoxiclav is 25 to 45 milligrams per kilogram per day in doses divided every 12 hours. So twice a day lang po itong co-amoxiclav. So availability in oral form is 200 milligrams plus the 28.5 clavulanic component per 5 ml. Meron ding 400 milligrams na amoxicillin and 57 milligrams na clavulanic per 5 ml. So let's compute for the co-amoxiclav. So patient's weight is 24 kilo, 9-year-old. So namaga ang uso niya pagkatapos sumakit yung ngipin. So pediatric dose is 25 to 45 milligrams per kilogram per day. Preparation, I'll choose the 200 milligrams amoxicillin and 28.5 milligrams na clavulanic per 5 ml suspension. So we multiply the weight of the patient to the maximum pediatric dose, which is 45 milligrams per kilogram. So your answer here is 1,080 milligrams per dose. So 1,080 milligrams per two doses per day is divided by 2 rather is 540 milligrams per dose. Okay, sorry, again, this is per day. 1,080 milligrams per day. So 540 milligrams divided into the amoxicillin component, okay, which is 400. So that gives you 6.75 ml dose every 12 hours. So when you write your prescription, you write co-amoxiclav. Kasi ang available na makikita ninyo when they buy the co-amoxiclav is 457 milligrams per 5 ml. Since kanina we computed it into the amoxicillin component na 400. So you write the brand name, 1 bottle, dispense 1 bottle of 60 ml. So give 5 ml every 12 hours for 4 days. Come back on the 3rd day for tooth extraction. Or come back on the 4th day for tooth extraction. Clindamycin naman. Clindamycin is a gram-positive bacteria and anaerobic species associated with oral infection. This is very effective for odontogenic infection. It possesses good activity against gram-positive and anaerobic. The development of resistance to clindamycin has not been as common as resistance to your macrolide or your antibiotic or your amoxicillin or your penicillin. However, GI upset is the most common adverse effect of clindamycin, including diarrhea associated with Clostridium difficile toxin, and it could be in oral and in IV formulation. So the spectrum of activity, availability of oral and IV formulation, this has made the drug a good option of management for oral infection. So, pwede siyang suspension, meron ding capsule, and injectable. So, for children, there are two types, no? The hydrochloride or palmitate. So, in children, you have 8 to 20 milligrams per kilogram per day in 3 to 4 divided doses as hydrochloride. For palmitate naman, it's 8 to 25 milligrams per kilogram per day in 3 to 4 divided doses. Okay. So availability in form, there is 75 milligrams per 5 ml. So how do we compute for prescription for clindamycin? You get the patient's weight, 30 kilograms. Patient's age is 12. Maga at masakit ang ngipin. Now, I use clindamycin kung merong sensitivity sa amoxicillin. Okay. So we use the 75 milligrams per 5 ml preparation. Now you multiply the weight of the patient to 20 milligrams per kilogram per day. So that's 600 milligrams per day. And 600 milligrams, you divide it into 4 doses per day, is 150 milligrams per dose. So 150 milligrams, you divide it into 75 milligrams and multiply it to 5 ml, and you get 10 ml per dose every 6 to 8 hours. So this is how you prescribe. So you write the drug of choice, clindamycin, and then underneath it is the brand. Dispense 1 bottle of 60 ml. Give 10 ml every 8 hours for 4 days. Come back on the 3rd day for extraction. So it always coupled with surgical intervention. Ano? Hindi lang pag-take ng gamot. Okay? So you have to encourage the patient or the parent to come back to you kasi you can tell them na yung effect ng gamot hanggang ganito lang. Otherwise, uulit-ulit, ano? Or the second blow may be mas matindi yung reinfection, okay? Kung hindi matanggal yung ngipin. Okay? So, this is the last part of my lecture, the antibiotic prophylaxis, because some of you may be prescribing prophylactic antibiotic for your cardio patient and high-risk patient. So this is indicated for medically compromised patients. Ano? So just briefly, you can take a picture na lang. So this is antibiotic prophylaxis for dental procedures are indicated for the following, for high-risk patient for cardiac condition. So prosthetic cardiac valve, including transcatheter implanted prosthesis, prosthetic material used for cardiac valve repair, okay? Patients who had previous endocarditis, okay? Congenital heart disease patients, including unrepaired and cyanotic patients, no? Kasama rin yan sa binibigyan ng prophylactic antibiotic. Okay. So except for condition listed above, antibiotic prophylaxis before dental procedures is not recommended for any other form of cardiac or congenital heart disease. So dental procedures for which prophylaxis is reasonable in patients with cardiac conditions listed on reverse side. Okay, so yan yan. So when we perform the following procedures, routine anesthetic injection through non-infected tissue, taking dental radiograph, placement of removable prosthetic or orthodontic appliance, adjustment of orthodontic appliance, placement of ortho brackets, and shedding of deciduous teeth, and bleeding from trauma to lips or oral mucosa. So the AHA does not recommend prophylactic antibiotic to these dental procedures. Okay. So here's the dosages for prophylactic antibiotic. This regimen is a single dose taken 1 hour before your procedure. So sa adult, it's very easy. You give the adults 2 grams, so that's 500 milligrams of amoxicillin 1 hour before your procedure. In children, you compute it using 50 milligrams per kilogram for prophylactic antibiotic. That's for amoxicillin. For clindamycin, you use 20 milligrams per kilogram. Okay, yung dalawa lang naman yung ating pinaka madalas gamitin for prophylactic antibiotic. All right. So other high-risk patients, paano naman po yung iba? Patients with compromised immune system may not be able to tolerate a transient bacteremia following invasive dental procedures. That's why the following listed here are non-cardiac factors can face a patient with compromised immunity. So going back doon sa slide ko kanina na question na, can the patient combat this infection? Okay, so kung immunosuppress yung bata, kung may HIV, okay, severe combined immunodeficient, may neutropenia, patient is undergoing therapy or cancer therapy, okay, or head and neck radiotherapy, okay, all these things may require prophylactic antibiotic. But of course, we have to consult with the child physician if this is recommended for the patient. But as per the APD guidelines on antibiotic prophylaxis for dental patients at risk for infection, they are definitely recommended for these patients. Okay, and that ends my lecture. Thank you very much for your kind attention, and I hope you learned something this morning. Thank you.